Welcome everyone to our February webinar. My name is Elisa Klein and I'm the Director of NERI Press and Training Center. I'm really glad that you're all here. I want to welcome you to today's webinar, which is called LATTICES, an integrated treatment approach for high-risk forensic clients, presented by Jane Ward and Diana Groner. We are very lucky to have published just a month ago. The books came out, the LATTICES books, and we'll tell you more about them and offer you a discount on them for attending this webinar after the presentation. We're in the middle of a snowstorm here in New England, and the snow is coming down like mad. But we are soldiering on, and I am pinch hitting today for Craig Latham, who was going to host this webinar but lives on a remote mountain without any Wi-Fi, so I am your host today. Before I turn the webinar over to our presenters, Jane and Diana, I want to take a few minutes to tell you a little bit about NERI Press and Training Center, especially for those of you who are new to our webinars. Our mission is to create materials on the latest research and best practices in our field. And originally, NERI was just a press, and we published books. But over the last several years, we've morphed into a training center, and we've expanded our mission by disseminating knowledge in new ways, like these webinars. We always like to hear from you, our audience, and the people who we provide the resources to. So please give us some feedback. Let us know what you think about these webinars, what topics you'd like to hear from us about. I'd like to do a short poll just to find out how many of you have participated in a NERI Press webinar in the past. So click on your poll there. Let us know if you've participated in the past or not. Okay, I see that most of you actually have. So you've heard the patter before. 82% of you have been on a NERI webinar before, and 18 of you have not. So thank you for being repeat visitors to a NERI webinar. Okay, so let's do a little bit of housekeeping. The first thing I'd like to share is the learning objectives for today's webinar. First of all, you participants will learn how facilitator characteristics and style interact with high-risk clients' treatment needs. 2, develop an understanding of how brain deficits in high-risk clients inform effective treatment approaches with these clients. And 3, gain familiarity with the LATTICES curriculum. As with all trainings and workshops, I'd also like to let you know that the learning of, I am repeating myself. I also want to let you know that the YouTube recording from this webinar will be posted on the NERI Press website within a week. Slides are currently ready to download from the NERI Press webinars page at neripress.org/webinars. If you'd like to follow along, you can also download the slides. Actually, I'm not sure if they're available here on your panel. I believe they are, but you can download the slides from our website as well as here on your panel. An important request of you, when the workshop is over, please be sure to answer the short survey at the end so we can get your feedback. And as you listen to the webinar, please be sure to send any questions that you might have for the presenters in the chat box, as Jonathan showed you at the beginning. And finally, in about a week, you'll receive a follow-up email with a link to the recordings and to a certificate of attendance that you can download. All right, I would like to introduce our speakers. There they are in pictures. You'll see them in virtually in just a moment. Jane Ward is a PhD. She's a licensed psychologist in the state of Oregon. Jane has been working for 13 years with men who have sexually offended, 4 years in a civil commitment facility, and the rest in an outpatient setting. Jane is also the owner and clinical director of Oregon Center for Change, an outpatient sex offender treatment facility. Diana is a licensed professional counselor, an LPC, a master's level licensed therapist in the state of Oregon. Diana has been a treatment provider in various outpatient settings since 1997. Diana has 20 years of experience working with domestic violence offenders and 9 years of experience working with men who have sexually offended. Welcome, Jane and Diana. We're very happy that you're here and looking forward to this presentation, and I will hand it over to you.
There, I think we did that right. Show my screen. Okay. So, hi, I'm Diana Grainer, and this is Dr. Jane Ward. Hi, welcome. So as you just heard from Elisa, we are treatment providers with an outpatient setting program in Portland, Oregon, where it's pouring rain. And we are eager to tell you all about Lattices, which is the book that we have just published through NERI. And as you heard from Elisa, we have a lot of experience between the two of us, and including the assessment and treatment of men who have committed various interpersonal offenses. And getting right to it. So about 6 or 7 years ago, we were working together at an outpatient clinic that did not separate clients by risk level. However, the risk needs responsivity research was really clear. You have to separate high-risk clients from low to moderate risk clients. And we encouraged the owners of the agency to let us start a high-risk group. Now, we had some knowledge already to start such a program, but we knew we needed to know a lot more. There were no other high-risk programs in our area at the time, and the only nationally available program we could find, we really did not like. We had some philosophical differences with. So we started learning more. We read books and journals, we took classes, and started drafting what became the Lattices program. And over the course of several more years, as we ran the program, we continued to refine the curriculum until we felt it was ready to be shared with all of you. And what we learned over the last several years is put together for you into these two books, the Clinicians Guide and the Client Workbook. We look forward to receiving feedback as people start to implement the Lattices program so we can make some further improvements.
Alyssa already talked about the learning objectives. Just want to emphasize that the first one there is that the who of what we are and the how we interact with our clients, with the high-risk client special needs, is very, very important part of the Lattices program. We're hoping that by the end of this webinar, you have a better understanding about how their special needs interacted with the curriculum that we've created. The Lattices program consists of two books. There's the Clinicians Guide and the Client Workbook. I want to talk about the Clinicians Guide first. It consists of 10 chapters. Chapter 1 gives an overview of the clients and the facilitators that are appropriate for the Lattices group. It includes suggestions for assessment tools, and it gives some suggestions for how to determine when the program has been completed. Chapter 2 describes Andrews and Bonta's risk need responsivity model as it's applicable to high-risk clients. Chapter 3 and 4 address the responsivity issues for the treatment provider as well as for the client, and we're going to be talking more about that during this webinar. Chapter 5 includes the 6 ideals that need to be fostered to create a healthy group culture for high-risk clients. Running a high-risk group is qualitatively different than running a more conventional group. Because our work with high-risk clients is difficult for even the most seasoned clinician, Chapter 6 offers ideas about self-monitoring for vicarious trauma, and it offers some resources for that as well. Work with high-risk clients also evokes concerns about safety, and so Chapter 7 offers suggestions about how to create safety through group norms, through the physical environment, and through organizational policies. Chapter 8 details the lattices mnemonic, which we will also be talking about during this webinar. Chapter 9 is the nuts and bolts of running a group, kind of how to orient the group, group size, how to begin and end the group, how to handle homework, how to use the client workbook. Chapter 10 is the actual LATTICES curriculum, which consists of 37 modules. We're going to review one of those modules today during the webinar to show you how it works. And just for clarification, that Chapter 10 of the Clinicians Guide is kind of the companion to the client workbook.
So just to be clear, this is what we mean by high-risk offenders. Men with an extensive criminal history or characteristics of antisocial personality disorder. And they don't have to fully qualify as psychopathic, but they do tend to have higher than average scores on the PCLR. And regardless of the current conviction that might have brought them to treatment with you in the first place, underneath it all, these are the main factors. These are the issues that help us identify appropriate clients for our LATTICES group, and they are some of the factors being addressed by the LATTICES curriculum. Now, we have been running the program for sex offenders for several years now, but we wrote LATTICES so it applies to any violent forensic offender. So we think it can be used with domestic violence offender programs, gang member programs, in prison treatment programs, and so forth. And when we began writing this book, we found that we spent equal or more time discussing how to engage these clients as we did writing the actual modules. The curriculum is important, but equally important is the responsivity factors of the treatment provider. The most well-written curriculum is worthless if it's run by the wrong person or implemented in the wrong way. Who runs the group and how they run the group are an integral part of the LATTICES program. We discuss responsivity issues of the facilitator in Chapter 3 in the Clinicians Guide. These are the 9 personal characteristics that we describe in Chapter 3, and we think they are key for a facilitator to bring them into the therapy group. We've seen groups in other places where the main focus is maintaining control over these so-called dangerous clients. And this power over approach clearly does not work and just helps reinforce the client's view that life is a power struggle. Instead, what our experience has shown us is bringing in these qualities to the treatment room removes the power struggle and allows room for change. It is important to maintain some control over the group. It's just done in a different way. So non-defensiveness. We are okay with our clients sometimes challenging us and our positions, our values, and our authority, because that can lead to a deeper conversation. Another characteristic is gentleness, having the opposite of a harsh or punitive stance. Serenity is important because high-risk clients don't usually have good social skills. They interrupt and they're very opinionated. So rather than push back against that, it's important for us to remain unflappable. Groundedness is a strong sense of your own self, so you can't be uprooted easily, because that's what some high-risk clients enjoy doing. Many high-risk clients enjoy verbal sparring or trying to one-up each other. They can be entertained by trying to make us, the facilitators, squirm, or trying to prove that they are smarter than us. So it's important to be grounded in our sense of ourselves. It's also important to have a healthy sense of power. High-risk clients divide the world into perpetrators or victims, and we don't want to be either to them, and we don't want to reinforce that sense of dichotomy. Authenticity means to be true to yourself, be genuine, and don't pretend to be someone you're not in some attempt to connect with high-risk offenders. Empathy. Even though some of our clients lack the ability to empathize, it doesn't mean we shouldn't have empathy. Empathy is a genuine part of who we are, and it gives us the ability to understand our client's perspective, and it's through that we are able to reach them. A sense of warmth is important. It models friendliness and good social skills. We are introducing the idea to them that people can be enjoyed rather than simply used. and a sense of humor. We use that to reflect and redirect the conversation and to lighten up the atmosphere sometimes. But overall, how the group facilitator personally relates to their work and to the clients makes a huge difference when working with high-risk offenders. Matching therapist responsivity attributes to the responsivity issues of the client can lead to satisfying work for the therapist and more successful outcomes for clients. So for those of you in a position to hire staff or to decide who runs which group in your program, Chapter 3 is the one to pay close attention to. If you're a treatment provider yourself and you're wondering if you're the right kind of person to run a LATTICES group, take a look at Chapter 3.
As we got deeper into the neurobiology of offenders, it became really clear to us that high-risk clients experience the world in a fundamentally different way than the average prosocial person. The treatment world is very aware of developing specialized treatment for people with like learning disabilities, with developmental disabilities, with autistic spectrum disorders. And we came to realize that high-risk clients need the same very specialized kind of approach targeted toward them. The differences and deficits were so clear that we coined the phrase differently brained to remind ourselves and to keep in the forefront of our minds that they are differently brained when we're working with them. They experience the world in a different way. We actually had to rewrite modules as we went through it for the first and second and third time because we had a really hard time seeing the world from their perspective because we are not brained the same way that they are. Research confirms that high-risk clients have brain deficits in specific areas, and this shows up in our work with them. The prefrontal cortex is where we execute long-term planning, we make decisions, we moderate our social behavior, we engage in complex thinking. High-risk clients tend to have deficits in all of these areas. The temporal lobe is where we process sensory information and language. Once again, areas where high-risk clients show a lot of deficits. And the amygdala, where we process emotions and memory, where most people would have that fight, freeze sort of response. We see that missing sometimes with the high-risk clients that we work with. The result of these differences and of being differently brained leads to different kinds of treatment needs. It has implications for the curriculum, for the what of what we teach, and it also changes the responsivity issues, the how we teach. We can't emphasize enough that LATTICES is more than just a curriculum. It's or like a list of topics to talk about, although it is that. A key factor in the LATTICES program is that responsivity piece, how to interact with these clients in a way that's going to reach them, that's going to make sense to them. It's important to read the full Clinicians Guide in order to really understand how high-risk clients need to be looked at and thought about in a different way and approached in a different way. We think this is something that's been very much lacking in curriculum for high-risk clients.
So we have identified 5 areas that interfere with high-risk clients developing prosocial attitudes and behaviors. We see language deficits, emotional deficits, characterological traits, behavioral deficits, and interpersonal deficits. And these 5 areas are directly related to their being differently brained. Now, we don't have time today to discuss all of these areas, so we're picking out one as an example. We will discuss what their emotional deficits are and touch on the ways that the LATTICES curriculum and the facilitator style address their emotional deficits. The Clinicians Guide gets more into depth with all 5 of these areas. High-risk offenders may have difficulty reading social cues, which can show up as an example of them being insensitive to other people's boundaries. An example of this is one time when I was, our high-risk group currently is early in the morning. So I was going in to open the office, and some of the guys were already in the hallway outside waiting for me. And somebody else in the building was trying to walk down the hallway through this crowd of people. And one guy in particular did not move out of his way, didn't even recognize that he was in the way, and didn't occur to him. So that's an example of difficulty reading social cues. With emotion regulation problems, our high-risk clients often either overreact or underreact to emotional situations, or simply lack normal emotional responses to situations. An example of this is a client of ours that once was describing this moment in his life where he was standing in front of his parents' graves, and he talked about how he felt angry because he realized he felt nothing. Standing in front of his parents' graves, he felt nothing. And he had enough self-awareness to know that was not the average reaction to that situation. High-risk clients' brain deficits can lead to an inappropriate fear response. So we had a client in one of our groups one time literally say, that whole fight or flight thing, I don't have flight, I only have fight. He had a faulty fear response. And high-risk clients can have difficulty decoding other people's emotions. They might have difficulty understanding other people, and since they have difficulty with empathy, they have a hard time seeing things from other people's perspectives or understanding or valuing other people's emotional experiences. The LATTICES curriculum addresses their emotional deficits mainly through skill building. For example, we have modules on anger management, assertive communication, non-aggressive body language, and interpreting social cues. Being in group every week is also a chance for them to practice their skills, as they have to practice taking turns speaking, listening to each other, and being willing to agree when they disagree and not turn into an actual fight. And once again, we want to emphasize that the responsivity of the facilitator is as important as the responsivity for the client. How we run LATTICES may seem counterintuitive at first. When you're in a room full of men with limited attention spans, aggressive posturing, antisocial attitudes, and maybe a violent history, it's very difficult to not respond to them in a controlling way, just in order to increase our own personal sense of safety. But what we know is that power over other people's style does not work. It creates an unnecessary power struggle between staff and clients. What we need to do is to be constantly vigilant to our responsivity in the room every session. We must remain calm no matter how they act. We need to be aware of our own body language and what that says. We need to model respectful communication even as our clients are incapable of it. And we should express genuine interest in them in a pro-social way.
We've given you some background about the importance of responsivity of the treatment provider and the responsivity of the client and some of the highlights of the program. But now we're going to discuss more specifics about the actual LATTICES curriculum. We begin each group with this mnemonic device. And then we do the module of the day. We repeat the LATTICES mnemonic at the start of every group because it helps the clients to get focused on what we're going to be doing. It gives them a chance to show off their learning, which they really like to do. Also, they can use examples from their past week and their life that fits in with some of the concepts we're trying to teach. And it's a reminder of the key elements of the program. This mnemonic is one of the main things that we want our clients to walk away from the program to remember. It's kind of the hook that they hang their learning on. Every week we write this mnemonic on the board, and then we write down whatever it is that the clients brainstorm as they kind of tell us and remind themselves of what each letter means to them. I'm going to just explain what we're looking for in this mnemonic. In the long-term lifestyle, we want the clients to be thinking about their plans and their goals and how what they do today and every minute either adds or subtracts from that long-term goals. In Act Accountably, we talk with them about the importance of surrounding themselves with pro-social people and accountable people, and with making responsible choices. When we do the talk about thinking, we remind them about identifying and replacing thinking errors, about listening to their self-talk, and about getting the opinions of others. We call that borrowing a brain. We talk about the importance of borrowing a brain. Take time refers to them stopping and thinking before they behave, taking some time out if they're feeling angry, and also taking time to appreciate some of the things and reward themselves for the gains that they've made. Integrity inside is about having that personal strength and reliability, and it's kind of that idea of that your word means something. If you say it, you mean it. Consider the consequences. We discuss the long and short-term consequences of a decision. We talk about the positive and the negative consequences, and we talk about consequences to self and others. In Effort for Excellence, we encourage clients to tolerate boredom and repetition, which is difficult for these risk takers. And it introduces the concept of mistake discovery, that you don't just throw in the towel if something doesn't work the first time. In See the Situation, we encourage the clients to look at their habits of thought and to be aware of their personal filters. Chapter 10 in the Clinician's Guide is the curriculum, and it's 37 modules that are broken down into these 8 different sections. These modules address the central 8 risk need factors identified by Andrews and Banta, the treatment targets identified by Yockelson and Samnow, and the criminogenic needs identified by Robert Hare. So those different areas are your thinking, pro-social life skills, social signals, decision-making skills, goal setting, you and others, self-management, and healthy partners. This here is a screenshot of one of the modules. I'm just going to walk you through it to give you an idea of what each of our modules looks like. Yet we take this sheet into group with us every time. Even though we've presented these modules repeatedly, we still refer to them regularly. It has suggestions for questions as it lays out sort of the next thing that you can do during the group. Every module has 4 parts. There's the treatment target, which is the research-based treatment target that the actual module is addressing. It also has a thing called Note to Facilitator. And in this, this Note to Facilitator sort of gives you information that you want to kind of hold in your mind as you're presenting the module. It often identifies some of the research that is part of it. It also kind of orients you as a facilitator to what it is you want to be thinking about as you are presenting the module. It also includes occasionally bumps in the road that we found that we've encountered while doing the module, and it gives you some ideas for how to either avoid those bumps or how to deal with those bumps in the road when they come. The third part of each module is called the group activity, and it's divided into teach, brainstorm, and some of the group activities have a discuss section as well. In this particular module, you see the teach section, that's the didactic part. And then the brainstorm sessions are when you start to begin that interaction with the group. Running the LATTICES group is a very active process. The whole time, the facilitator is standing up and writing on the board what the clients come up with during the brainstorm activities. Also, the facilitator sort of uses their movement in the room to keep the attention of the clients on what's going on up at the board. The teach moments tend to be pretty short and very directed. They're just a jumping off point into the brainstorming things, which is the very interactive part of the group when the clients get to do their own thinking and teaching of each other. There's also, as a part of each module, the homework section. This gives clients a chance to practice during the week and on their own some of the things that they may have learned during the group. The LATTICES modules are written specifically enough so that two clinicians in two different settings are going to be covering about the same materials with a similar approach. However, just to be clear, it's not a scripted program. We don't tell you exactly what to say. It's more like a lesson plan or something so that you can know what to cover and you have some ideas about how to approach covering it. We do offer suggestions for questions to ask the group, for examples of discussion points, reminders of the principles that you're supposed to be covering, but it's something that you can adapt to the group that you have in front of you. This is just a page out of the client workbook. There's one page per letter of the LATTICES mnemonic at the beginning of the workbook, and this is meant for clients to add their notes to in group every time. They maybe write words or phrases, draw pictures, whatever it is they're thinking about that relates to that mnemonic letter in every day. When they put it in their own language, it seems to deepen their understanding of what it is we're trying to teach. The client workbook, so it's just a screenshot of one of the client workbook page that's associated with the Borrow a Brain Part 1 that we looked at earlier. There's one page per module for clients to work on. For the clients who learn best through listening, what we do in group is very helpful to them. For clients that learn better through writing things down, this is an opportunity for them to use that learning tool as well. As you can see from this picture, the workbook directly follows kind of the flow of the group discussions and the brainstorming that happened during the group. As we're talking and writing on the board, the clients are writing in their workbooks. You may find that some clients use the workbook a lot and take a lot of pride in carrying it around. Other clients, not so much. Either way, as long as we want to make sure that the workbook is available to them, just that we're responsive to those different kinds of learning styles. We intentionally designed the workbook so that it wouldn't be embarrassing for clients to carry it around. The Clinicians Guide, the title is like Forensic High Risk and all of that. And all that we have in the client workbook is workbook. And the clients think it's cool looking on the outside. So, and just as a reminder, the homework section doesn't take more than about 5 minutes for clients to do. Some of them do it on the train ride on their way to group in the morning.
So to summarize, the Clinician's Guide has 10 chapters. The first 9 chapters lay the theoretical basis for the program, and chapter 10 has the curriculum. For anyone learning about, or working with high-risk offenders, the Clinician's Guide gives you a way of understanding these clients, how they think and how they operate in the world, and gives suggestions for how to be effective in gaining their cooperation. More than a treatment program, LATTICES is a how-to guide to working with high-risk offenders. So we see LATTICES can be used by parole and probation officers. Criminology and forensic psychology professors might find it useful in their classrooms. Supervisors of clinicians working with high-risk offenders should also be finding LATTICES useful. We see it as a treatment program that can be used in prisons, in civil commitment programs, and in outpatient clinics. And although LATTICES was written for the group setting, it can also be adapted to individual sessions as needed. We would also love to see researchers out there looking at the program and testing its effectiveness. So we're going to turn it over to questions in just a minute. And here is our contact information in case you have questions later on.
Okay, thank you so much, Jane and Diana. That was wonderful. Really helpful to understand the Lattices books. We have a number of questions that have come in, so I'm going to read them off to you in the order that they came in to us. And we will have about 10 minutes for 15 minutes for questions. And people, please feel free to continue to send them in. So the first question is, your description of high-risk clients being differently brained reminds me of the brains of people who have suffered childhood and adult trauma. Has your research shown any correlation between past trauma and the engagement in abusive behavior or offending?
Wow, great question. Thank you. Well, to be clear, we were not doing research of our own. We did literature review and studying and learning from and work based on our own experiences with these clients.
But I think it's absolutely true that trauma, when I do intakes on these guys, one of the things I do is the adverse childhood experiences. And just from my informal noticing, the guys the clients that we're getting into the high risk group definitely have higher scores than our more conventional clients, or a lot of them do, not all of them do, but there's certainly, and we talk with our clients when we're talking about them being differently brained, we actually talk with them about that so they understand it. And one of and during that particular module, when we're discussing that with them, we brainstorm all the different reasons that somebody might have be differently brained, and a lot of times we end up talking at quite length about childhood trauma because a lot of our high-risk clients have experienced things like that.
Thank you. The next question is, what is the ratio of staff to clients in a typical group?
Cute. Yeah, it's one of the ways that we guarantee safety for everybody and comfort. One of the clients will, or one of the facilitators will be facilitating the group. The other facilitator will be watching the group, checking out how clients are reacting, checking out body language, making sure we're not missing anything, because you really do need 2 pair of eyes on these guys.
Yeah, it can be a pretty chaotic group setting sometimes too. So it's helpful just to have 2 sets of eyes and 2 sets of ears.
It's I would like to say it's managed chaos, but you know they're not very good at. Sometimes it's good to have another person say, "Hey, just a second, let's hear this guy out, and then let's hear from you." It's like herding cats sometimes, and you need more than one person to do that effectively.
So that actually segues to a question that I was asked. How do you guarantee safety in the outpatient setting?
Well, we have 2 whole chapters on that in the clinician guide because that is such an important piece. A big kind of overall answer to that is that there's group norms that we really work hard to develop. There's pieces of the physical environment that we focus on, like having 2 clients, making sure that that there's other people in the office, making sure the door is open, things like that. And some of the group norms that we develop are being transparent with our clients, being respectful to our clients, making sure that they have freedom of choice, that they have a sense of safety in the room. We make really sure that, what our only group rule is there's no threatening behavior or verbalizing, and it's the one thing that we'll ask somebody to leave if they get like that. And then also what Diana talked about earlier in the webinar was that balance of power, that we're really careful about kind of like flattening out that hierarchy. That seems to help us and help the clients, feel safe and feel like they're not being threatened. We also have like organizational policies and structure. I think it's very important for there to be peer supervision. We process the groups before and after groups happen. You want to be in an organization that understands that high-risk clients you're not always as successful with the outcomes with them, and not have it be like a blamey kind of situation. So you want to have supervisors and the people that run the organization understanding high-risk clients themselves, and having a situation where people who are facilitating the groups feel comfortable to say, I felt over my head in the situation. I wasn't sure what to do. I need some help. All of those things, I think, help keep the group feeling like a safe place. I miss stuff, I'm sure.
Well, that's why there's two of us, again. I think the way that we approach the high-risk treatment program really is multifaceted. I mean, it helps us make sure that we're reaching the clients. It helps make sure that we're getting effective outcomes. And it also helps make sure that there's very little reason for the clients to become reactive and argumentative with us in the first place. And that helps solve a lot of the safety issues before there even is an issue, I think.
Right.
Yeah.
Yeah, that makes
They actually seem to enjoy coming to group.
Yeah.
You know, and oftentimes the first couple of times they come in, it's like they're really pissed off about being there.
That's
but
right.
Pretty soon they really look forward to it. So
Thank you. So, and that's a good segue to a question that came in. Could this curriculum be appropriate for men who are not considered high risk?
Interesting question. So we did design it with the risk factors in mind, the essential 8 that Andrews and Bonta identified, which would be appropriate for any treatment program, forensic treatment programs to address. So I don't know that there would be any harm done in using the LATTICES program with more conventional clients, but I think it might miss the point with them a little bit. It is really designed for the higher risk people.
It seems like that you could use it, but we have like in our note to the facilitator and so on, we're talking specifically about high-risk clients. So the way we just got talking about, flattening the power hierarchy isn't necessarily something that a more conventional client you're going to need to think about or do anything with. Your more conventional client might have empathy, and even though that is not necessarily identified with reduced risk, it's an important element of a treatment program that the LATTICES program does not address. So you'd have to add some things to it.
Right. The LATTICES program has almost
potentially modify it.
Pardon?
You could potentially modify it for
yes.
A slightly different kind of client, it sounds like.
Absolutely. There's a lot of modules that would go for anybody. Mm-hmm.
Okay. Somebody asked, how long does a group last and for how many weeks?
Or years?
So each session takes about 90 minutes. Normal group treatment takes more like 2 hours, but we find our high-risk offenders do not have a very long attention span. So 90 minutes is about the longest they can handle. As for how long the program lasts, we usually have weekly sessions, and we want everybody to see the curriculum at least twice to help get their learning really in there. And with 37 modules, it ends up taking about 2 years in our outpatient setting.
Okay. Low literacy is an issue for my clients. Would this be a barrier to using LATTICES?
We kept that in mind as we designed it also, because that is part of that kind of differently brained part, as well as a lot of offenders have low education success. Their criminal lifestyle kind of started young, and education wasn't exactly a priority for them. That's why the workbook is very simplified, and they can put whatever they want in there. They can draw pictures, they can just write phrases, they can copy down exactly what we have on the board. Homework assignments are very short, and again, they don't have to be well written. It's just as long as there's some sort of attempt to finish the homework. We don't even actually like grade homework or anything like that. We're just trying to encourage a pro-social attempt of thinking about our assignments outside of the group session.
It's one of the things we talk about in the clinician guide is homework is about trying it. Yeah. And if you've tried it, that's fine. And if we have a guy that just doesn't read at all, or English is a second language, we just have him tell us something that he thought about during the week regarding what we talked about. So yeah, low literacy, not a problem. It's all very interactive in the room. Like that's 95% of the program. Yep.
It does seem that in using a curriculum like this, you're always going to be adjusting, modifying to some extent. You know, you have this as the basis from which you're working, but you're kind of working with the group that you're working with.
Right. Yes. Yeah, absolutely. Yeah, we have suggestions, and sometimes we follow our suggestions and sometimes we don't. It depends on the group and what's going on in the group. And because, you know, they also bring their life experiences in, and sometimes we readjust things to, you know, to take care of that. So.
Great. This is a related question, I think, to the last question. How could this be, or how would this be adapted to youth or those with cognitive challenges? So you answered the second part of that question already, but what about working with youth with lattices?
I think it's a little hard because just because we don't want to label a juvenile as a high-risk offender, that needs to be done very cautiously. A lot of the assessment tools are not appropriate for juveniles. So we actually say that the Lattices program can be used down to maybe age 16, but it really is designed more for adults, largely because it's mostly adults that can be clearly labeled a high-risk, dangerous offender, and that's a lot trickier when you're talking about somebody who's 12, 14 years old.
But there's also ways that you can take certain modules out of the curriculum and adapt them. Yes. I do think that there's value in that if you're looking at it more as using some of the modules.
It could be a starting point at least. Sure. Yes.
So somebody has asked to see the contact information again. That might require Jonathan. Can you go back or allow Jane and Diana to share their screen so they can show that slide again? Can you show your slide with your contact information?
There we go.
Do you see it?
Well, let's leave that up for a few minutes so people can get that information.
Yes. Dr. Ward is the owner and director of Oregon Center for Change, and so that's probably the easiest way to get a hold of us.
And we're happy to answer any questions people have or whatever.
I know often people don't have questions until much later when they're back in the office, and it's hard to come up with questions during the seminar, so get a hold of us later.
Well, we still have quite a few questions, so let's keep going. We have about 5 more minutes for questions. The question here is the curriculum designed to utilize one module per week?
Yes.
Yes, one module per session.
Okay. Has this program ever been used in a civil confinement setting or just outpatient? You mentioned civil commitment, I think.
I worked in a civil commitment place, but no, we began this and it's only been used in outpatient setting at this point. But it could very easily be used inpatient. There's nothing outpatient about it.
Well, and that's where a lot of the higher risk offenders are going to be. So we do think it can be used in civil commitment programs, mental health hospitals, prison systems.
Sure.
Yes.
So you may have answered this, but this question is asked in a slightly different way. What is the time length for the group for getting through the workbook?
There's 37 modules. So if you're meeting weekly, and I do want to say some of the modules take more than 1 week occasionally, because we also do at the beginning of our group a very short check-in. If there's a client who's had a lot of issues come up during the week, we may talk about those, and that ends up making it so that it takes us a couple of weeks to get through one module. So generally speaking, it's like
1 year.
1 year
to
do the full curriculum. Yeah. Okay. And we recommend the clients go through that curriculum twice in an outpatient setting. And the POs, the probation officers and so on, want to see them in treatment for a couple of years as well. So it all works out fine.
So you're talking about a good 2 years that somebody would be working this curriculum, it sounds like.
Yeah,
Well,
ideally.
the risk principle gets into dosage of treatment too. So the highest risk offenders need the largest dose of treatment. However, that plays out in your setting. So the most number of sessions or the longest time in treatment, whatever makes the most sense.
Okay. How large are the group sizes? Do you have any recommendations about that?
With outpatient setting, we actually have a fairly larger size group, just because there's so many people that end up being suspended or temporarily in jail on probation violations, that the actual head count of who shows up to sessions is much lower than who's on the attendance list of who should be there.
Right.
So we can run the census pretty large, for at least in outpatient settings. That might end up playing out differently if you're in a civil commitment program or prison program.
We have, I think, 12 clients right now who are officially in the group, but I think 4 of them right now have been suspended for like super high balances. We've got a couple that are incarcerated for a few months. So we're running like at about 6. So we always recommend that you get more people on your roster.
Yeah.
I mean, if you want to, you also have to, you know, from a business perspective, make sure that
you can pay the bills.
You can pay the bills. So we run a higher number than we would in a more conventional group.
Yeah.
So that's actually directly related, I think, to the last question, depending on how long it takes to answer. But is there much attrition? Is the group open? So do people come and go from the group as it goes on?
Yes. It is open and running, yes.
Mm-hmm.
And there is higher attrition with a higher risk group than with an average group, which is another reason why we can let the roster be a pretty high number, because people drop out or get incarcerated at a higher rate.
Okay.
And then we have other guys that have been coming very regularly for, 2 years, and they're close to graduating. So that's always really exciting.
We actually have a voluntary client currently.
Yeah.
Okay, so this is going to be our last question. It's interesting. It's a question that came up for me as well. Are any members in the group in different modules at the same time?
No, the same group has the same series of modules in the same order.
Right.
Yeah.
Okay.
So they're going to,
I'm sorry.
Enter the program at different times, but they'll cycle through it twice.
Yeah, they get exposed to everything eventually.
But it's nice because clients that have been there for a while, if they're going through it the second time, can be helping the newer clients learn what they're supposed to learn and all that. So it works out really well.
Okay. Do you have any last words before we move on to the closing business? Thank you so much.
Thank you.
Thank you very much. All right, Jonathan, we need to return the screen now. Okay. Okay, so as you can see here, we have 4 webinars remaining in this year's webinar series, and we look forward to seeing you on them. And you can always see this list and sign up, of course, at NERI Press and Training Center's website, neripress.org. Paid CEs will be available for psychologists and social workers for all webinars this season. For details about how to obtain those CE credits, please visit neripress.org/webinars. Read through our CE process, and if you still have questions after that, you can always email my colleague Kristen Lobisch at klobisch, KLOBISCH, @neri.com. As you can see, LATTICES is a wonderful curriculum. We have 2 books that you can get a discount on because you participated in this webinar. We sell each of them individually, or you can also buy them as a set using the code MARCH1 when you check out from the bookstore, or if you call, you can tell them that code. And the discount code will be good until March 12th. So please consider purchasing LATTICES. You probably already know that we offer a monthly newsletter in which we discuss a new or controversial journal article or research paper and examine its implications for clinicians and the field. If you're here on the webinar, you're automatically signed up for this resource, so you should be receiving our newsletter. We are so grateful to our sponsors. You can see them all here on the screen. The only reason that we're able to hold these webinars and keep them free is because of these sponsors. So thank you so much. Take a minute to look at all of the wonderful organizations and individual clinicians who serve as sponsors for the Neary Preston Training Center website. If you like this webinar, you can see previous webinars on our website at nearypress.org and on Neary Press's YouTube channel. It's possible to pay for CE credits for all past recorded webinars. Thank you so much, Jane and Diana, again for such a great webinar. Thank you to all of you who have attended this webinar. Please be sure to complete your evaluation form when you close out the webinar. Thanks so much. Bye-bye.